Every 2 minutes, someone suffers a stroke and another has a heart attack. No warning signs, no alerts, and sometimes no second chances. As a brain specialist, I've seen far too many seemingly healthy people collapse without notice in situations that could have been prevented. What troubles me the most is this: many heart attacks and strokes could have been avoided with just a few small changes in daily diet. Today, I want to share with you a simple, natural weapon, something sweet, small, and surprisingly powerful that has been scientifically proven to lower the risk of heart attacks and strokes. But how you eat it matters. Done the wrong way, it can do more harm than good. Start now. Don't wait until it's too late. Why am I talking about blueberries? This tiny, sweet, blue-purple fruit may look ordinary, but it carries a power that modern medicine is beginning to recognize more and more. In medicine, blueberries are known to be one of the richest sources of anthocyanins, the compounds that give them their deep color. More importantly, anthocyanins are powerful anti-inflammatory and antioxidant agents. What does that mean? As antioxidants, they help neutralize free radicals, dangerous molecules that damage blood vessel cells and brain cells. As anti-inflammatory agents, they help calm silent inflammation in the blood vessel walls, a major factor in the buildup of plaque and the formation of blood clots. In other words, blueberries are more than just fruit. They are a natural medicine that supports the prevention of heart disease and stroke. You don't need a prescription. You don't need a pharmacy. All you need is a trip to the grocery store or your local farmer's market. But it doesn't stop there. Clinical studies have shown that eating just 50 grams of blueberries a day for 8 weeks can lower your systolic blood pressure by an average of 5 to 6 millimeters of mercury. A reduction strong enough to cut your risk of stroke or heart attack by 15 to 20%. That's not hype, that's real science. And beyond heart health, more studies reveal that regular blueberry consumption can improve short-term memory, boost focus, and slow cognitive decline in older adults. So, now the big question is, what exactly happens inside your body when you eat blueberries regularly? In the next section, I'll walk you through 5 science-backed mechanisms that explain how blueberries directly impact your heart, blood vessels, and brain, and why you should consider making them a daily habit. Let's take a deeper look. 5 science-backed mechanisms why blueberries help prevent stroke and heart attack. Mechanism 1. Reducing silent inflammation inside your blood vessels. Imagine your blood vessels like smooth, flexible pipes. When inflammation occurs, even mild, symptomless inflammation, the inner walls become rough, sticky, and prone to plaque buildup. That's the perfect setup for atherosclerosis, clots, and eventually, stroke. Blueberries, thanks to their high anthocyanin content, help soothe the endothelial lining, block free radical damage, and lower inflammatory markers in your blood, like CRP, C-reactive protein. When inflammation goes down, your blood vessels stay smooth, flexible, and free-flowing. No plaque, no surprise clots. Mechanism 2. Naturally stabilizing blood pressure. High blood pressure is the silent killer of the brain and heart. Blueberries are rich in potassium, magnesium, and polyphenols, nutrients that help relax blood vessels and reduce peripheral resistance. The result? Lower blood pressure, a heart that doesn't have to overwork, and a dramatically lower risk of brain vessel rupture. This isn't theory. One study on older adults found that drinking just 1 blueberry smoothie per day led to an average 5-point drop in systolic blood pressure after 2 months. For people with early-stage hypertension, this is a powerful, natural prescription. No side effects, no pharmacy required. Mechanism 3. Lowering bad cholesterol and preventing arterial plaque. LDL, often called bad cholesterol, isn't always the enemy, unless it gets oxidized. And that's the real problem. Oxidized LDL sticks to your artery walls, triggers inflammation, and forms plaque, the #1 cause of blocked arteries and heart attacks. Blueberries are packed with antioxidants that prevent LDL oxidation. which means no oxidation, no arterial damage, no plaque, no heart attack. Mechanism 4. Protecting and nourishing brain cells. Ever seen a loved one after a stroke struggling to speak, walk, or remember basic things? That's because their brain cells were permanently damaged. Blueberries don't just protect your heart, they also protect neurons from oxidative stress and increase blood flow to the brain. Multiple studies on older adults show that regular blueberry intake improves memory, attention span, and even reaction speed. For middle-aged adults, this may be one of the most natural ways to protect against early cognitive decline, Alzheimer's, and dementia. Mechanism 5. Balancing blood sugar, reducing stroke risk in diabetics. Diabetes slowly destroys blood vessels, especially the small ones feeding your brain and heart. Many people suffer strokes without ever realizing their metabolism had been deteriorating for years. Blueberries have a low glycemic index, are rich in fiber, and improve insulin sensitivity. This helps stabilize blood sugar levels, prevent diabetic complications, and reduce the risk of both stroke and heart attack. And there you have it. Just one small handful of blueberries a day can touch nearly every corner of your cardiovascular and neurological system. In the next part, I'll show you how to eat blueberries the right way, so these incredible benefits aren't just theory, but something you actually experience in your body every single day. Do you want to protect your heart, or wait until it gives out? How to eat blueberries the right way to truly protect your heart and brain. Now you know that blueberries can protect your heart, lower your risk of stroke, and boost memory. But here's the catch. How you eat them determines whether those benefits actually happen. I've seen too many people eat blueberries the wrong way and get no results at all. So, as a doctor, let me give you 5 essential rules to follow when adding blueberries to your daily diet. Rule 1. How much should you eat? The answer: half to 1 cup per day, or about 50 to 150 grams. That's the amount shown in clinical studies to help lower blood pressure, reduce inflammation, and improve brain function. You don't need a lot. What matters is consistency. Rule 2. When is the best time to eat them? Morning is the golden hour. Ideally, pair blueberries with oatmeal, Greek yogurt, or a bit of chia seeds for better blood sugar control, longer satiety, and improved digestion. Short on time? A simple smoothie, blueberries with plant-based milk or water, can be a powerful natural dose to start your day. Rule 3. Fresh or frozen? The answer: both are great. Frozen blueberries retain their anthocyanin content. As long as they're frozen properly, the antioxidants stay intact. Just make sure they're unsweetened and free from additives. Rule 4. What to avoid pairing them with? Many people mix blueberries with sugary cereals or use them in desserts, but that completely defeats the anti-inflammatory purpose and often spikes your blood sugar. Avoid refined sugar, syrups, or blueberry-flavored smoothies loaded with preservatives and artificial coloring. Rule 5. Who should eat blueberries daily? Anyone over 40 to help prevent stroke and cognitive decline. People with high blood pressure, high cholesterol, or diabetes. Anyone with a family history of stroke or heart disease. And honestly, anyone who wants to stay mentally sharp and focused for years to come. Blueberries aren't magic, but when you eat them the right way, they can create real, lasting change in your heart and brain health. Common mistakes when eating blueberries and how to avoid them. Here's what I see in a lot of my patients. They learn about the benefits, start eating blueberries, and nothing changes. The problem isn't the blueberries, it's how they're used. Here are the 3 most common mistakes and how to avoid them. Mistake 1. Choosing the wrong type of blueberry. Packaged dried blueberries may seem convenient, but most of them are loaded with added sugars, preservatives, and even hydrogenated oils, completely sabotaging the anti-inflammatory and blood sugar benefits. Fix it. Choose fresh or frozen blueberries. No additives, no sweeteners. Mistake 2. treating blueberries like dessert. People mix them into muffins, top them with whipped cream, or drizzle syrup to make them taste better. But doing that spikes your insulin and reverses the cardiovascular protection you're aiming for. Fix it. Use blueberries as part of a whole meal. Oats, smoothies with no sugar, or just eat them plain. Mistake 3. Being inconsistent. You eat blueberries today and forget about them for a week. That doesn't work. Blueberry benefits come from daily, steady use, just like brushing your teeth or taking medication. Fix it. Make blueberries a regular part of your routine, even if it's just a few spoonfuls each morning. Blueberries aren't a miracle cure if you use them the wrong way, but used properly, they can become a powerful shield protecting you from heart attacks, strokes, and memory decline. Let's wrap this up with one final message about your health. We can't control everything in life, but we can absolutely choose what we put into our bodies each day. And sometimes it's the small, simple actions we repeat consistently that become the shield protecting us from the most serious health events. I'm not claiming that blueberries can replace medication, but I do believe this tiny fruit can help you avoid needing medication down the road. If you're over 40, have a family history of stroke or heart attack, or simply want to stay healthy, live longer, and keep your memory sharp, then building a daily habit of eating blueberries is a great place to start. You don't need a lot. You don't need anything complicated, just consistency and the right approach. Now it's your turn to speak up. Have you ever tried blueberries? How do you like to include them in your breakfast? Share your thoughts or favorite ways to enjoy them in the comments below. I'll be reading every response and will highlight the most interesting ones in an upcoming video. And if you found this content helpful, don't forget to hit the like button so YouTube can share it with more people. Subscribe to the channel so you don't miss important health topics, and share this video with your loved ones, family, friends, parents, anyone who could protect their health with one small change in their daily diet. Take charge of your life, take care of your health, and don't wait for illness to knock on your door before you start making changes.